study that we're going to be talking about today pertains to the immune system. So there's something known as a neutrophil to lymphocyte ratio. This is a marker from a complete blood count that can tell us a little bit about inflammation that's going on in the body. So neutrophils and lymphocytes are two different types of white blood cells. And when you look at the ratio or the proportion between the two, they can tell us whether there is subclinical inflammation going on in the body. When it comes to the immune system, neutrophils are like your first responders. They're the first to the scene, whether there's an infection, a cut, a cancer, a virus. Lymphocytes, however, are specific to when there are cancer or viruses. Lymphocytes are known as part of the adaptive immune system. Neutrophils are known as your innate immune system. So the ratio between the neutrophil and lymphocytes can tell us whether there's a lot of inflammation going on in the body. It's also a prognostic marker when we're talking about chronic inflammatory diseases. Chronic inflammatory diseases are things like cancer, heart attack, stroke, diabetes. So we know that the neutrophil to lymphocyte ratio can be used as a prognostic indicator of whether your chronic inflammatory disease is either getting worse or getting better. Now, what's interesting about curcumin is we already know that curcumin is a powerful anti-inflammatory. How? Well, we know that it can modulate some of these inflammatory markers in the body. In a double-blind, placebo-controlled clinical trial that took place in 2021, 60 patients over the age of 60 were given curcumin for 4 weeks. At the end of the 4 weeks, their neutrophil to lymphocyte ratio was reassessed, and they were found to have a statistically significant decrease in their neutrophil to lymphocyte ratio. What we can conclude from this is that not only can curcumin have an anti-inflammatory benefit, it can also help to modulate the immune system. Curcumin is well known for its myriad of different health benefits. Today, we're going to be diving into some of the cutting-edge research that shows how curcumin can benefit your health. I'm Dr. Sonia Malani, and I'm a board-certified integrative oncologist, and today we're going to be talking about the latest research on curcumin. Let's dive into another serious health crisis, arthritis. Arthritis affects 1 in 4 adults in the United States. There are more than 100 different types of arthritis, but today we're going to specifically talk about something known as osteoarthritis. Osteoarthritis is kind of the wear and tear arthritis. It's known to be almost the aging arthritis. It's not autoimmune in nature, however, it is inflammatory. Osteoarthritis right now affects more than 32 million adults in the United States and can really inhibit quality of life and daily functions. In a 2021 randomized double-blind placebo-controlled trial, 101 patients with osteoarthritis of their knees were either given 500 milligrams twice a day of curcumin or given placebo. They were then assessed to see how quickly they could go from sitting to standing, how well they could tolerate a 6-minute walk test, and were also asked about their pain. At the end of the study, researchers found that pain-relieving medication was reduced in 37% of the participants that were given curcumin compared to 13% of the participants that were given placebo. This shows that curcumin not only has an anti-inflammatory benefit, but it can also help with pain, especially in patients who have osteoarthritis of the knees. The next study that we're going to talk about deals with a symptom that many women deal with on a regular basis, period pain. In a triple-blinded, placebo-controlled clinical trial that took place in 2021, more than 100 patients were given either placebo or 500 milligrams of curcumin for the 7 days before their cycle up until 3 days after their menstrual cycle. What researchers were looking at was to see if there was a reduction in PMS, premenstrual syndrome, as well as period pain, or dysmenorrhea. What researchers were surprised to find was that there was a 64% reduction in period pain in those that took curcumin before, during, and after their cycle. Period pain is something that affects a lot of women. It's meaningful to see something safe and effective like curcumin can reduce the pain that many experience on a regular basis. Today, we talked about how it can be helpful in things like modulating the immune system, as well as osteoarthritis, period pain, and PMS. But we also know that there's some evidence coming out that shows that it can be helpful in things like polycystic ovarian syndrome, elevated blood sugar or hyperglycemia, and it can also be used in conjunction with many chemotherapies. For example, it can be used in conjunction with chemotherapy known as FOLFOX in metastatic colorectal cancer. If you're interested in learning more about topics like curcumin, as well as root cause medicine, make sure to subscribe to our channel.